Thank you for tuning in to watch Workforce Wellbeing and Cultural Change via Creative Health. This event is brought to you by our Midlands Creative Health Associate Jane Hurst in partnership with Royal Derby Hospital, Air Arts and the National Arts in Hospital Network. The event is part of a 4-part series of roundtable discussions showcasing creative health leadership in the Midlands and beyond. To access other event recordings in the series, please visit the NCCH website at www.ncch.org.uk and view our blog pages. Now, without any further ado, let's introduce the panel.
So a very warm welcome to everybody here in the room today at University Hospitals of Derby and Burton NHS Foundation Trust. You're at our main site today, the Royal Derby Hospital, so big warm welcome here. And a warm welcome to this event, which has been put on by the National Centre for Creative Health, all about workforce wellbeing and how we can support the wellbeing of our workforce through creative health. I am Laura Waters. I'm Head of Arts here at Derby and Burton Hospitals. I'm also co-chair for the National Arts in Hospitals Network. And the picture for creative health in hospitals has changed dramatically over the last 4 years. I'd say before the pandemic, most arts hospitals in the UK focused almost entirely on patient experience and patient environment. There was some work being done with staff and the workforce, but really not very much at all. Since the pandemic, I would say that situation has changed to being more like a 50-50 split now between working for supporting patient wellbeing and working for staff wellbeing. So that has been a huge, huge sea change. And that's been really supported here in Derby and Burton by our amazing wellbeing team. So our staff wellbeing programme is run in conjunction with our wellbeing team at the hospitals. And they provide the much needed psychological and therapy support for the staff, many of whom are still suffering from post-pandemic trauma. So for them to be able to access creative health activities and then to be able to get additional support afterwards has been really valuable. And that picture is repeated in many trusts around the country as well. So creative health has really grown in the last 10 years or so. It's been a fairly meteoric rise. For those of you who are not familiar with the term, it's a fairly new term and it encompasses the arts and all creative activities that might support wellbeing. So as well as the main art forms of dance, music, theatre and visual arts, creative health also encompasses things like cooking and gardening and really any activities where the participant is creating something new and the activity provides wellbeing and recovery support. So looking at workforce wellbeing, National Centre for Creative Health have started to take this on as a bit of an agenda item to try and see if we can push this up the agenda for our workforce. So we know the NHS workforce are really struggling at the moment. There's big problems with burnout and recruitment and retention, as is evidenced through the NHS staff surveys. So it's really, really important that we try and support our workforce. So it's really great that National Centre have taken this on as a discussion point in their roundtable series. So in May, we had an event here where we invited our regional hospitals from the Midlands to come and talk to us about their workforce wellbeing programmes. And at that session, we started thinking about developing a theory of change model to look at how we might be able to scale up and expand some of the programmes that we're delivering in the Midlands. And we had a fantastic session with a poet, Beth Calverley, and Beth put together some poetry from the day, which we're going to share later on as part of the recording of this. But I did want to, if I can find it, there was a poem that she used called Evidence, and she used it as a starting point. And it's a poem by Wendy Cope. So this was our first provocation, and this poem is called Evidence. Centuries of English verse suggest the self-same thing. A negative response is rare when birds are heard to sing. What's the use of poetry, you ask? Well, here's a start. It's anecdotal evidence about the human heart. So that was our starting point for our theory of change. And it's really just to to really make us think about how do you possibly measure something like the value of poetry. And this is maybe part of the problem, is trying to create an evidence base and research around the impact of creative health on workforce wellbeing. So that's really our aim today. Is we've got 3 amazing speakers with us today. We're really very fortunate to have this wealth of experience and a really diverse range of roles and diverse range of interests in workforce wellbeing. And we're going to discuss how we might be able to embed creative health activities and practices within a variety of workforces to support wellbeing. So I'm going to allow the speakers to introduce themselves. They're each going to talk for around 10 minutes on their specialist subjects. And then we're going to open it up to be interactive. It'd be really great if you could think about any questions you'd like for the speakers individually or collectively. And so I'm going to ask Kate and Emma from my team after that to come around with a roving mic. And so we can have a discussion after they've given their talks. So without further ado, I shall introduce Paul, Ruth and Matt to talk to you about their thoughts on workforce wellbeing, creative health. Thank you. Over to you, Paul.
Thank you very much, Laura. Good morning, everyone. Nice to see everyone. Alex, can we have the first screen? Yeah. So I'm Professor of Health Humanities at the University of Nottingham. And back in 2006, I actually founded this new field, which is global now. That's how things are moving quickly. It's not just AI, it's everything else. Health humanities is an evolution really out of medical humanities. And you will find that there are many traditions here. Laura mentions creative health. There are different, if you like, brandings for activities and also underpinning philosophies or reasons for that. I felt back in 2006 that medical humanities was a little bit fixed on medical education and the training of doctors. I thought there was much more to be had in terms of inclusion, other professionals, also, as far as I'm concerned, the public. So over recent years, I've been very involved in trying to get the public back into public health and to see the public and patients as having agency. So it's not just about practitioners. It's also an activist movement in terms of trying to change through evidence and through argument around the world the centrality of creative practices to human life. And Laura mentioned about the pandemic, and we know from studies, for example, in terms of lockdown and cabin fever, that the mental health impacts can be huge of isolation and lockdown experiences. And although practitioners perhaps will have had different traumatic experiences, we found during that informal experiment into long-duration spaceflight with billions of people in lockdown, that it was very damaging. But we can do things about such challenges through creative practices. We know from the evidence base already, which is growing all the time worldwide, for how creative practices can advance human health and well-being, including practitioners. So as you see on this slide here, health humanities is a kind of a collecting device for all different types of traditions that can work on that mission. So it's very much mission-based. These are some of the publications. I'd like you to buy 10 copies each. Okay, no. But this one was the first manifesto on health humanities after the field description in 2010. And this was very important. It was translated into Mandarin as well because China, with its large population, knew that centralised services couldn't reach all parts in terms of the nation's health. And then followed up with the Routledge Companion to Health Humanities. And unbelievably, from 2006 to now, we're now in the realm of an encyclopedia in this area with lots of relevant information for everybody about creative practices. So it feels a bit AI, doesn't it? Yeah, that short span going from zero to encyclopedia. One of the things I'd like to just draw attention to briefly today, if I may, is the new series in Emerald Arts for Health, which I'm leading, and there are currently 16 short volumes out already, and there will be about 30 to 35 in total. And each of these books is written in an accessible way for the general public, for practitioners, for family carers, goes through, it will go through, I think, nearly all the modalities for creative practices that you can think of. And they're nice because there's a little history to start with each one about, let's say, games or singing or theatre. And then there's a summary of the evidence base for those creative practices in terms of health and well-being, and then goes on to case studies for that, so relevant to lots of readers, and helps and guides. So these are doing very well. Do have a look at those if you wish. I think they're doing 3 for 2 publishers. Anyway, the key thing behind this is I saw that there was an informational gap, and this bears on perhaps what Laura's trying to do today and with our fellow speakers, in terms of how do we get further, how do we embed, how do we actually, if you like, bring ideas to bear in people's either arts-modified practice, in arts-modified environments, and arts-modified processes within healthcare settings. I think this is a starting point. Some years ago, finished in 2018, a big study called Creative Practices as Mutual Recovery, and that was with funding from the Arts Humanities Research Council. And that 5-year study had 13 different projects, all looking at how creative practices, diverse practices, can help the mutual recovery within and across groups. So patient groups, family carers who carry a big burden, and as Laura said, particularly with the pandemic, our practitioners are also, struggling. So that project was very successful in actually developing evidence about the benefits of working as a community, not just segregating patients from practitioners, from family carers, but looking at whole community recovery of our best possible lives. Okay. There are many other projects we can't mention today. We've got other speakers. This was the last project that I led, which was fantastic with, I don't know if you know Ardman, Shaun the Sheep, Wallace and Gromit. We worked with 42 young people, and actually during the pandemic as it happened, again funded by Arts Humanities Research Council, with young people to create new animations, which you see here. And you can go to whatsupwitheveryone.com or Ardman's YouTube to see these animations to support young people's mental health. And it worked. I mean, it's helped. So firstly, it reached over 17 million in the first 4 months alone of launch during the pandemic, and they stopped counting because you need additional monies to track everything that's going out. And our scientific evaluation of the animations, pre and post, showed improvements in mental health literacy. So watching these type of animations. So we're very interested in health humanities and the work I do locally, but also obviously in a global sense, looking at how we can transform and change the informations we give, make informations more available so people can act, because people have agency and they don't necessarily need a prescription to take up creative practices. If they've got key information, then we can move forward. And that includes practitioners. How might singing help with my stress levels? Okay. How may a reading group benefit, etc., etc. Okay, this is just a little bit of the social media feedback. Obviously, when you reach millions of people, even collecting feedback is interesting. But we were moved emotionally during the pandemic by young people actually contacting and saying that the videos helped them a lot, particularly loneliness during the pandemic, loneliness and isolation video. I didn't play them today because technical issues happen and it can interrupt stuff. But if you go on whatsupwitheveryone.com, you'll see the videos, you can watch them, and there's follow-up informations on there and also seeking help page as well. But yeah, people actually felt accompanied, I would say, a lot of young people were very lonely and isolated and disrupted, as you know, during the pandemic. So that wasn't an example directly on the practitioner stuff. The creative practice of mutual recovery was a big mission. I had hoped, as you can see here, because I'm in the boardroom of Ardman, I had hoped to win one of those for the team, you know, and go on a bit of red carpet, but it didn't happen. But what did happen, we got lots of awards for this work, including the Design Week Awards in 2021, and recently, quite nicely, the Best Public Engagement with the Institute for Policy and Engagement Awards. So all good. So we're winning awards, but that's not the point. The awards are a kite mark. They show that the actual work is valued, that it works, and creative practices, and this is just one example. There are many other programs of work going on around the world. They make a big difference. So increasingly, the government, Laura, and around the world are looking very clearly at this whole creative practice side as shadow health service. You know, not replacing the centralised service, but assistive and adding to it. We have many more social and cultural assets in this country than hospitals, but we need to look after our people in hospitals too. And I think Laura here has been doing a lot of work on that with Our Hearts, and around the world, many people are looking at how practitioners can be kept healthy to do the work they do. So thank you very much.
Thank you, Paul. I think the really crucial element there is the concept of mutual recovery. So it's really important to keep our workforce well in healthcare services, partly because we want to keep them well and keep them at work, but also because you've got the element of mutual recovery. And I like the idea of the whole community recovery there. If we keep the workforce well, we keep the patients well, and you get that beautiful virtuous circle. I mean, incredible level of work there. So delighted to introduce Ruth, who is now going to bring us down to a much bijou scale, which is it's really fantastic model that Ruth has got in her organisation. I think would be amazing to hear about. Thank you, Ruth.
Thank you, Laura. Okay, so hello everybody. My name is Ruth Mills and I'm CEO of Designs in Mind, which is a design studio in rural North Shropshire. We are a design studio with a difference because we are a CIC and we work with a tiny team of 6.5 full-time equivalent staff, which does include artist practitioners and staff with listening expertise, and our design team of 100 adults, all of whom come to us with severe and enduring mental health challenges. So our members are referred to us through a network of prescribers, which includes GPs, hospital outreach, and mental health, community mental health services. So our adults come to us, our members come to us on Tuesdays, Wednesdays and Thursdays, and we work with them to create artwork that is developed into community art projects, so art for public spaces, commercial design collaborations, such as our collaborations last year with Habitat and Scion, Sanderson Wallpapers, and also products which we design and make in-house and are sold in our online and our street retail shop. We also make products that are manufactured off-site that we sell online on our website and also in our retail shop. So what's really interesting about Designs in Mind within the context of creative health, I think, is how we work as a community. And I know when we were visited by the National Centre of Creative Health, that was something that really stood out. As a community, it's really important to us to create warm and encouraging environments for our members. After all, they come to us with very, very complex needs. You can imagine, however, how complex it is for our staff to work with those members. So we work very hard to make that environment warm and encouraging for our staff too. There's no hierarchy at Designs in Mind. Although we have an artist team that leads the work, our members are the designers. How we achieve that is through real collaboration and peer support. And that is something that shines out and you can take forward in any kind of creative activity in your environment. There's something really magical about working alongside someone and making something. Our members come to us to work with our design team and they're led through a series of workshops. However, during those workshops, the collaboration happens by one person might make something and it is developed by another person into a product that's sold in our shop. one person might make a series of collages and someone else might develop it into a piece that goes to one of our design collaborators, one of our commercial partners. So it's truly collaborative. This really stands out in some recent review work I did with our members, where there were comments such as, "I can't believe my design was on the wallpaper for Habitat, and isn't it special when you can send your postcard with 3 members' work to your friend in Japan?" So it's real work and it's ambitious, and that also makes us really special at Designs in Mind. When we work side by side with each other and there's no hierarchy, I think that peer relationships develop. And whether in a clinical setting or a work setting, those peer relationships where you can give each other support are so important. It's very different to art therapy, and we don't offer art therapy at Designs in Mind. The fact that the work we make is ambitious and purposeful means that our members know that everything they do is going towards the studio. And that really allows us to develop those relationships. I'm losing my thread a bit, sorry. I had a really good think on the way here, and as I was preparing for this, about how we can scale our model. Clearly, Designs in Mind can't happen in every environment. It's really unique and special. If only I could scale it up, I'd love to. There are challenges for scaling creative health, and it would be foolish to speak about creative health as a CEO of a tiny creative health organisation without talking about funding. I think as practitioners, we need to work really hard to develop our relationships with funding partners, but also with each other. Well, it's very interesting listening to you today, Paul, because one thing we've been talking about a lot at Designs in Mind is how we can find out why our service works and how we can collaborate with more academics. One challenge that we face as a creative health organisation is sustainable funding. And one of our major funders is our ICB. And developing understanding of new funding protocols is something that certainly will require a lot of work. I think something we could all talk about more is how we can make those funding relationships more two-sided, less funder and funded, and more collaborative. And I think that's something that really needs to change. What is really promising, however, is how there are funding opportunities developing more and more now that are available for leaders to develop creative health organisations. I think this is important because to scale up any kind of creative health, we need our leaders to be able to have some sustainability in terms of having time to plan how to scale. And I do believe that the more we can work together and less in silos, the better that will be. Thank you. I had a long think about key takeaways to bring to you today. How can you use the methodology of Designs in Mind where we're working on projects that are going to be made into real art and design that's sold or seen in the environment in lots and lots of different settings? I think the magic of what makes it work for us is the fact that we have ring-fenced time and space for making. We have a reading group that happens on a Monday afternoon, and some of our most challenged members attend our reading group and get a huge amount out of that. So that ring-fenced time for reading, it's 1 hour, is hugely impactful for some of our members. So, for example, we have one member who lives with a diagnosis of schizophrenia, and that's how she engages with us at Designs in Mind. But that 1 hour a week is hugely impactful on her. So it doesn't have to be hugely complex. It can be really grassroots. Another aspect to take away is expertise. And I think that when we're embedding creative health in our organisations, we need to be careful that we're linking in with people with the real expertise to deliver the very highest quality of activities. I think I've used the word ambitious already. And we at Designs in Mind, we're proud of the fact that our art and design is ambitious. We're very discerning as people, and I think it's important that we engage with quality practitioners. Another key takeaway is how to develop community. And I think the best way to do that is to take one of the models from Designs in Mind is in that there is no hierarchy in making. We welcome everyone to our studios, from the most challenged to the artist lead. Anyone's idea is important when we develop our projects. Thank you.
Thanks, Ruth. I think it's clear to say there's an ambitious project you have going there. It's really impressive. And I think it was lovely to hear about that in terms of it being clearly mutual recovery in action. It's a real life example of the work that Paul was talking about. And I also like the idea of there being no hierarchy. I think that's one thing that we find in our staff wellbeing work here, is that when staff come to one of our wellbeing sessions, the NHS hierarchy, which as we all know is fairly set, is left at the door, and people enter that space as a maker and a creative. So it's really lovely to hear that phrase used. So I'm now going to hand over to Matt, who's going to talk about the work in the film industry, and how, again, it's a real life example of how creative health is being supported in industry. Over to you, Matt. Thank you.
Hi, everyone. My name is Matt Longley. I co-founded a little CIC, very similar to Ruth, about 7 years ago, called 6 Feet from the Spotlight. We look after film crews, music crews, theatre crews, and people working in games, so across the creative industries, to look after their mental health and well-being on set. I founded it 7 years ago after, unfortunately, I'd lost a friend who took his own life, who I'd met working on the Harry Potter films. So we found there was a big issue across the industry with mental health and well-being. People generally are freelance. There's probably, I think, something in the region of 80,000 people at its peak will work in the film and TV industry. Most of them are freelance. So we needed to find a way of changing it. So we've gone about, over the last 7 years, trying to change an entire industry and how an entire industry works. How did we do that, I suppose, is probably one of the questions. So the first thing we did was we had evidence. So we found there was evidence. There's an organisation called the Film and TV Charity who every couple of years now run a report called the Looking Glass Report. So they go and ask people what it is, how their mental health is, and how do they feel when they're working in the industry. Shockingly, they found that 89% of people reported having had a mental health issue whilst working. So that's over and above what we see in general population of 66%. I know the NHS is probably higher than the general population anyway. So we had some evidence. We also had evidence that people did not want to talk to their management. So there was a lot of stigma. Because you're freelance, if you make a complaint about how you're being treated at work, then you don't get your next job. So people don't then move on. So we had to find a way around doing that as well. Lots of other evidence which was related to the diversity and inclusion policies, because a lot of creative funding is based around how diverse and inclusive you are in a particular industry. And people from those different backgrounds were finding that they had even more mental health troubles because they weren't being embedded in the industry. So there were lots of things for us to go at. We started off, there's probably then trying to influence, I suppose, the whole industry. So going along, there's other evidence there. There's a great report called Deloitte and Mental Health and Employees, which comes out, I think they do it every 3 years. And what that shows you is the causes of people having stress and mental health issues within a workplace, and then tries to assign a cost to it. So what the Deloitte report actually shows is that it's around £46 billion per year in the UK alone, the cost of people having poor mental health at work. We extrapolated that to the film and TV industry. The film and TV industry in this country is worth about £7 billion. So that works out about £500 million that's lost. Deloitte also go further, and they say if you can do these things, you will improve your mental health and well-being, you will improve your performance of people, and it's around £2,000 per employee, which means the costs actually, if you get it right, they found ways that you could get an 11-to-1 return on your investment. So that's one way that you can start to influence people, is to use that. That's the carrot. So there's a carrot there. We also found there's a stick. So health and safety law in this country is set out, and that's where I come from. I'm actually a chartered chemical engineer, so how I've ended up on the set of Beetlejuice and Harry Potter is a very long story that I'm not going to go into. However, there's a stick there. The health and safety law basically says that we must prevent things. So if you know that you're going to cause people stress, you must then do something about it and try and stop that. You should do a risk assessment. Not many organisations actually have a very valid stress risk assessment. So we've started teaching productions how to do a stress risk assessment. The next part of a risk assessment is really you're making a plan. So making a plan for what you want to do and how you're going to change and prevent issues from occurring in your workplace is kind of key. We can do that. We do it with very small short films. So we work on short films that are funded by the BFI, and the BFI actually fund for us to go on to that. We then go up to massive productions. So the last one I did was Beetlejuice 2, which we had 600 crew. So they're quite big things to do. What we found is that the best way that it works is we make a plan before we even start. So we sit down and we work out what kind of plan we're going to do. We'll go and work out how we're going to train people in what our plan is so that they know what we're doing and why we're doing it. So it's a lot of communication and consultation. We collaborate. So we collaborate across departments. We collaborate with the producers. We collaborate with the industry as well. So we're working very closely with the British Film Institute, with BAFTA. We haven't got to the Oscars yet. We have done BAFTAs. We provide people on BAFTAs for the BAFTAs. There's a new organisation coming out which is going to be hopefully government funded, because obviously at the minute we're in PERDA, so nothing can actually happen, but called the Creative Industries Independent Standards Authority. So there's all sorts of people we can collaborate with. So going at it as a whole industry and actually having this massive plan as to how we're going to tackle each of the individual things, because the things that cause people mental health issues are stress, they are their own personal issues that are happening outside of work, bullying, harassment, and the biggest one, bad management. So when people don't know how to manage and are managing, usually because they've been, especially in the film and TV industry, we were talking about a famous director the other day, and he came on set and he's just shouting and swearing at everybody, whereas most of the productions that I'm working on, where we've set everything out in the first place, everybody's very gentle and calm. But bad management is one of the key things around consultation with people and communication as well. Generally, the people who are the camera team know how to run a camera. So when the director starts shouting at them for how a camera works, then they get stressed, and it doesn't work. So a lot of management stuff. We've gone from strength to strength. We now have 25 people who work out on film and TV productions across the country when they're actually filming things. Obviously, there's been a strike for a little while, but we go from these small little BFI films up to the big ones and all the little ones in between as well. So really, I think the thing is to plan, collaborate, use your evidence, carrot and stick. Those are the main things. So probably the 5 things that you probably take away from this. So yeah, get your evidence in place, work out how that relates to what you're trying to do, be that creative health within any industry, but also then how you can actually embed it further is to look at collaboration across departments, having your peer support, and if everybody on the floor wants it, then other people will start to listen. So every production we go on, generally the crew are like, "Oh, I'm so glad you're here. I'm so glad you're here. We've needed somebody like you for ages." I actually go out on set as a what we call a wellbeing facilitator. So I actually go there and the crew can come and talk to me about their struggles and what's happening. We've got 20 of us who do that now. So they always want it. It's the producers then initially who were a bit reticent. The producers are obviously like the senior management, but now the producers are realising that actually having somebody like me on set helps them get a better product at the end of it. So some of the big productions we've done have been the best ones we've done where we've started really early. And I hope Beetlejuice 2 is really good because we did start very early on that one. I don't know obviously I don't know, but working with Tim Burton was a bit of a bucket list thing for me. So yeah, having that plan and making sure that the senior people are actually engaged with it as well, because they now are, because they've seen what we can do. We had an incident last week on a production I was on where one of the crew did not turn up to work and the producers had not got an idea of what to do. So I took them through the process of trying to contact, not contacting, and then putting in welfare calls and making sure that we got that covered. And the producers were like, I'm so glad you were here, because I didn't know how that would work. So having them on board really helps as well. But yeah, management. Thank you.
Thanks, Matt. I think a really interesting other perspective as well in terms of where this all has to start, because it's all very well having wellbeing there as lip service, but actually I think that there's a big question around leadership and management, and if the management support these initiatives, then they get legs. And presumably there is signposting that you can give to people if there are any issues that come up from anything that you come across in your work. I'm just thinking in terms of what we have here. We've got our wellbeing champions, wellbeing service, but it's got to be backed up by the proper support. Yeah,
so we have, I'm basically on set as a massive signpost. So it can be too. We do have a guy who ran cams in South Manchester who works with us, so I can signpost to him. But then we also have lower level therapeutic services that people can go to, but we'll also signpost them for financial support, legal support if they need it. It can be all sorts of things. I act as a coach, so I've got 30 years management experience myself. So I will coach some of the leadership team on how they should be managing people, and when they bring me somebody's not doing what I think they should be doing, or I've asked them to, and I'll coach them on how to deal with that process, rather than it going through an HR process, which is obviously can be disciplinary. We try and coach them on how better to manage people. Because sometimes there's a great book which is I can never remember the author, but it's called "Why Don't Employees Do What I Ask Them to Do?" That's all about behavioural management and behavioural coaching. So what is it that's driving people when you have conflict, especially when you have conflicting priorities in the workplace? That's one of the biggest things. So and so's told me to do this, but I've been asked by somebody else to do this, and now, but your actual strategy says that, and where do I go?
Thank you. So now it's over to you, our lovely audience. So if you have a question, it can be directed to any of our panellists, or if there's a general question, raise your hands.
Hello, thank you for that. It's a fantastic panel. Really great. So I'm Melanie. I'm from the Mental Health and Suicide Prevention team at the local authority. And I'm young enough to have had experience in all of your areas, unbelievably. So I spent 20 plus years in academia, working as head of design and animation up at Sunderland, and then Loughborough at the Animation Academy. Was part of Women in Games and Women in Animation, and then set up numerous designs for people with disabilities across internationally, Slovakia and India and in the UK, working to give them empowerment. So it's touched on everything I've done. You've just done my career in one. But the thing is, and I'm in Purda, is first of all, is the people that are in the film industry. As I was head of department, I would say there was a huge amount of students that had disabilities. So maybe undiagnosed or diagnosed. And we know there's a connection between neurodiversity and mental health illness now. And I'm wondering if you're embedding that, first of all, into your area of support, because it's an area we work on peer-reviewed research. So our direction goes in what comes out of need. And that, to me, there's no research that says why there's a lot of people that go into the arts, whether it's part of the brain, scientifically, whether it's exclusion, whether it's an area where, games animators can now work in their bedroom and be where their comfort zone is. But I spent a long time working within industry where I had to work with certain animators and so on that had mental health difficulties. But I always say, because of society and their lived experiences of living in a society that doesn't include. I'm wondering what your perspective is on that.
There's probably two things that are happening with that in the film industry. So one is, obviously, we come across people who either have undiagnosed or diagnosed health issues, mental health issues, and are quite often neurodiverse. So what we will do is try and teach and coach the production on how they might work with those people better. So using some specialists in the background who will help us with that. That's if people will actually divulge that they are that they have those that they're living with those conditions. Secondly, there is a big move now. There's another emerging role called access coordinator, which looks, and they are specialist people in the industry who are working to look at people with disability, be that mental health disability or physical disability, and how do they then access in the industry, and how do they get supported. They are part of the Creative Industries Independent Standard Authority as well, and we're working with them to make sure that there are standards within the industry to deal with the issues that you've raised and how you actually help people. So those are the two main ways that people are now getting help, because the industry wants to be diverse. It has to be diverse because of the government funding, but at the minute it doesn't necessarily know how to do that well. So there's a bit more. There is a lot more work to do in there. And how do you support people through? The big issue is funding and the fact that in a film production in particular, you gang up for 5 weeks or 6 weeks and go and make something, and then you all disband again. So people don't have the time to actually deal with some of the issues that come up, and then people will move on to the next one. So it's an industry issue that we're trying to change. It'll be interesting to see where it goes over the next few weeks, but some of the big companies, Warner Brothers in particular, Sky, they won't mind me name checking them, are doing some really good work in that space. So they invite people from different diverse backgrounds, including mental health, to work with them, and then provide the support networks. So a Warner Brothers production like Beetlejuice will have, I was the Wellbeing facilitator, so I went round, but there were access coordinators, there's an HR team, there's a support team in the background as well that we could access. So that's how they're changing it, yeah.
Brilliant, thank you for including that.
Sally. Thank you. Thank you. I'm Sally Varnham. I'm the Creative Health and Heritage Manager at the University Hospitals of Leicester NHS Trust, and the Business Development Manager for Bright Sparks Arts and Mental Health, CIO, which is part of the Leicestershire Partnership NHS Trust. Thank you for amazing presentations, and thanks for the massive workload that you've added to my massive workload to follow up and read about 30 books and get in touch with you all about your projects. So I think about this often. I haven't come up with a solution, and I don't think we collectively as people working in creative health have either. How do we defluff arts? We know that arts work. We're preaching to the converted very often in these rooms, and we can see the impact of art on patients and staff in hospitals. And what's really struck me about all of your presentations is that you're kind of working in different industries, and you're using language that is professionalised and kind of working perhaps in a different level of offering workshops within a hospital scenario. So I think that I'm confident in saying this on behalf of colleagues doing similar work, is that one of the main challenges and barriers that we have is convincing clinicians that the work we do is impactful in the way that you're describing. And what I'd really advocate for is some kind of conversation that's kind of crosses boundaries of industries and professions, that we do come up with a universal language that people do sit up, take notice of and take really seriously and put the money behind, because we know we are capable of propping up kind of more statutory health services. And, you know, in my mind, we could save the world, but I think we're a long way from that. So any advice on how you're going about that would be brilliant. Thank you.
Yeah, I can just response on that. I think the key thing, and it's great, you've said the magical words about, you know, we can't sort of get everything captured here. We can't get everything perfected. The Arts for Health series I mentioned earlier is actually written and targeted in terms of the public and for the general reader. So we're just reporting on some of the, if you like, professional research and professional work side. So I think the language thing's really important, and that's why that particular series tries to address that informational gap with case studies which are relevant to the public but also to practitioners. And there isn't the professionalese, that type of language, in those books in a disruptive way. It's to support. Just going back to the fluff or defluffing, which is an interesting notion. There's a lot of defluffing needs to be done about everything, and we can't tackle everything all at once. But I had a meeting with chief executives of hospitals a few years ago because they invited me down to talk about creative practices, mutual recovery. They were interested in that. They were interested in compassionate design of health services. And there was some resistance there, had to be said, about, well, the arts, it's entertainment and all this. And I just had to brief them on the massive amount of evidence now about the health and well-being benefits of the arts. And this was before we kicked off onto social prescribing, primary care cycles, and so on. And anyway, in that resistance, I thought, okay. And I checked up on Google before I went to the meeting, so I knew everybody in the room. So I just went round and said, how's the violin? How's the violin? I gather you play the violin. Yes, it's good, yeah. Yeah, it's great. I said, I believe you run a reading group, it says on your bio. So I went round the whole room, and they'd all invested in their narrative about the creative life and creative activities. I said, this seems to be something central to all of you as chief executives of your hospitals. Why aren't you actually getting the message that hospitals are environments that communicate with people? The people in those environments need well-being and support. And creative practices is one of the most cost-light in terms of assets that people can engage in. You don't need a randomised control trial. You don't do a randomised control trial when you go to the theatre. You don't do a randomised control trial when you pick up the violin. Anyway, I wasn't invited back. But, so, defluffing continues. But around the world now, I've just been in Taiwan to 3 medical facilities in Taiwan. Around the world, people know that creative practices are key to our life. We saw that in the pandemic. The creative practices was a buffer. It was part of creative survival during lockdown experiences. This is not peripheral. But we don't need to get fixed on interventions, in that kind of intervention cycle. Oh, I need a randomised control trial before I start having some arts modified practice. No, you don't. No, you don't. Get off your RCT horse and get back to some basic stuff. You wouldn't have existed through lockdown without Netflix. You know it. Come on. So whether it's receptive creative or productive creative, this stuff changes bodies and minds. The science is there. It's not all anecdotal. That was 25 years ago. We've moved on. And it's time that hospitals and healthcare environments move on.
Thank you. So my next question is going to be how? Is it a question of communication? Because I totally agree that the evidence is there. We've got the Creative Health report, we've got the Creative Health Review, we've got the Socio-Behavioural Research Institute. There's masses of evidence. We know it works anecdotally and research-based. But there's still a huge resistance, or not huge resistance, there is still some resistance. There's still that feeling that it's a nice to have rather than essential. So I wonder, is it around narrative and language, and is it around getting the message out there in a slightly different way. Because I've used a similar approach as Paul was describing, about asking people, do they have art in their houses? Do they watch TV? Do they listen to music? Do they like to draw? And people always say that they like to do these things and it's helpful. And it's just making the connection then between how people already use creative activities to support their wellbeing. So yeah, the question is it a narrative issue then?
Just briefly on that and pass to our other speakers. No, I don't think it's all talk. I think many people around the world are getting it, actually. So that's a bit of we need to get over that one. Around the world, creative practices are being used in hospitals, healthcare, and also in communities. So we're not on a zero level. We've got social prescribings coming to the primary care. We've got government reports going on all over the world about the value of creative practices in clinical practice, in the environments that communicate to people, raise their blood pressures and everything else, stress levels, through the environment being not human tailored, and then also the threat cultures that damage our compassion behaviours, and dealing with threat cultures and using creative approaches to adapt processes, to adapt environments, and to adapt, if you like, the community of practice as well. So there's lots of stuff. It's very positive news, I think. So we're not at the starting blocks here. We're more on consolidating, extending, and reminding, I would say.
I think in terms of where we are, we're at a point where we can't afford not to. We're seeing huge rates of burnout in the NHS. Before I worked in creative health, I worked in education, where there's a huge retention crisis. And I think we need to continue to make it clear to our leading bodies that we can't afford not to embed creative health. But for me also, there needs to be better communication between smaller organisations like my own and bigger organisations, so that we can stop working in silos and start to bring all of our knowledge to the fore more. Because I think there's so many crossovers. Your example of supporting individuals in the film industry, well, we support our members who come to us with severe and enduring mental health difficulties to stay in our workshops and make the design with listening support. So there's so much we can learn by just a brief conversation together. We need to keep on working together more, I think.
We come up against the clinical argument quite often as to the fact that we've just put wellbeing facilitators who are not clinicians out on set. Where I'm not professionally trained in as a clinician. I can run a chemical plant and I can work out how to manage people, but I'm not a therapist. So we get that quite a lot, and the pushback is it's something different. You're actually talking about probably the whole of somebody rather than just their mental health and stress, and how do you actually get them to perform and work better and enjoy that. And I think we also went through in the film industry a lot of talking about doing things, and when you actually then start doing it and actually get your little one production, we tried it first, then we went on another production, tried it. Some people moved on to another production and tried it, and you kind of get a bit of a mushroom kind of effect, that now everybody wants that. There are obviously some people who are still naysayers, but you can't change. There's the 80-20 rule. You're going to be able to change some of it. And the other, I always use a quote from Martin Luther King when I do my training, which is, you don't have to see the whole staircase to take the first step. So I think just trying and doing different things, if you've got a group, your own team, you can actually change that within that one place. So yeah, we go on different productions who want to do. Some of them are really, really receptive. Some of them want to start from the beginning, and I've just done one for Amazon where I didn't have to do a lot, but we set it up right in the first place, and I didn't have to do a lot. I'll go on another production where we didn't set it up right, and they got me in, they parachuted me in late, and then I've got all hell on to actually try and change things that are going on there. So I think that actually planning it, setting it up right in the first place, and doing that, you can then build your own, look, this is what we've done, and it becomes more than an anecdote when you've actually eventually saved people money.
Yeah, really good points there, Matt. And the whole business of practitioners and supporting practitioners in hospital extends to other industries, not just film. But I'll link you to the Royal College of Music and their work as well. But what I wanted to say in response was that do also consider the whole community. What I've seen around the world is that patients aren't empty; they are not broken entirely. They have resources, creative resources themselves. They're in our hospitals, and they also bring assets and they bring uplifts to our practitioners. Mutual recovery is really important to think of. And one story to say, which was about Bridget. Bridget was in Australia. She was going in for a second brain surgery, and I stayed in her flat for a while near Sydney, and we had a chat. And I said, how did you prepare for that? She said, well, actually, for my second surgery, I thought I need to be in a good position for the surgeon to do their best work. So I knew I was going into a white box, side room, white box, like a fridge or a dead meat storage unit, whichever you prefer, in terms of an environment. And she said, I wanted to get my stress levels sorted. So I brought all my Buddhist stuff in. I brought my smells and my music, meditative music and so on. And I made it more homely for me in the white box. That's the patient agency. And I said, well, that's fantastic. I said, how did the surgery go? I said, well, you seem fine. She said, yes. She said, it went very well. The surgeon was great. And it was wonderful. I said, that's great. She said, no, Paul, that's not it. I said, what do you mean? She said, what's surprising is that the staff on the unit kept coming into my room for respite care. And we need to be aware that the business of health is not just the business of health professionals. We need to be aware that the health of the nation is everybody. Creative industries, which I've been trying to advance through the work with Ardman, okay? The hospital management, the whole estates management, the creative practices on the corridor. Corridor's the biggest department in the university, of course, where everybody has to go through the corridors. Let everybody recover together. Don't sectorise the health side. This is practitioners to broken. No. It's all directions. And the mistake we make is aligning all this creative practice stuff with the interventionist stuff. Oh, is this like occupational therapy everywhere? No. It's creative practices everywhere because you know it's good for you, and even the science is telling you. So it's evidence-based futures, really, for health of any nation. You can't do it all from healthcare.
Any more questions? Yeah, over here, please.
Thank you. This is very interesting to hear all your perspectives. I'm Sarah Payne. I co-founded a therapeutic arts therapy organisation in Derby just over 15 years ago now. I'm a board member, and the last 5 years I've been more aligned with research in social prescribing and interventions within that, and sort of led a thriving communities programme across the Midlands. I heard a lot of issues, I'd say, with the connection when the NHS is kind of wanting to form a real holistic approach, person-centred, and a very personalised care industry or approach to their work. Part of social prescribing obviously is part of that personalised care. And I guess what I want in the time that I've been working in this area, and a recent project in Birmingham was really around the creative health referral pathway. So I've kind of focused more on the referral pathway. And one of the unfortunate common statements I would say was that I feel sometimes we've been set up to fail. That, okay, we want to do all these things and we're saying all the right things and it sounds fantastic and we are holistic and we all get it and there's loads of evidence, but where is it in practice? I was kind of like, well, where's the formation of this? How are we supporting providers in this better connection? How are we better articulating what it is that the industry, third sector, can offer, and its diversity, which keeps getting missed completely and misunderstood, and the inappropriate referrals, and then that causes really bad experiences and frustration and all these knock-on effects. So I felt like I was hearing a lot from, and this was shared by everyone. This wasn't only the providers who were offering in their communities a fantastic kind of arts or arts therapy or whatever it is that they're offering. It was also the workforce of referrers who were really frustrated with going, I know it's good, but I don't really know what's out there, and I don't know if it's funded, or whether I have to have that awful conversation about, oh, it's going to charge you, but the NHS doesn't charge, oh, this is just awkward. So I guess there's a couple of points I wanted to share around kind of whether you've heard of some developments around collaborations where it's a bit more of a structure, where the third sector kind of are encouraged to work better together. There's a kind of barrier to that in terms of the commissioning funding that you sort of touched on, the fact that it actually puts them in competition. So one of the fundamental shifts I'm trying to be working on is how do we move away, therefore, from that really bad dynamic of commissioning and funding? How can we set up collaboratives and people are invested in, and invested from different people, organisations, etc., on a very local level, and those collaboratives are formed by those providers and other key leads to support a money flow. And so questioning the way money does currently flow has been quite fundamental in a power shift, and so there's been a bit of work around that, and a pilot actually done in Derby that explored that kind of collaborative model and what happens when we invest. And actually, interestingly, what came out was really good relationships. So whilst it was fantastic that money started flowing in the right way, in a much more responsive way to people's needs in the community, they actually found they were building better relationships with the link workers and the other referrers. And that went beyond how the money kind of went about. Therefore, it gave an opportunity. It just showed that actually, if you equal that platform, there was a better communication and relationships formed. But also another part of this referral process, or this model that I've been looking at, is also that the articulation of arts provision and the fact that it all has incredible value, but how can that practically be implemented? And I looked at the sort of case management systems that link workers were using, and other sort of very practical tools, I guess. And there is kind of a opportunity where I was like, well, this can be embedded. There's something here developed. I've just pulled in people have done research in this area. People have kind of done this work. But I found that despite the people I thought would be responsible to kind of invest in making this happen, didn't get it. And it, I'm even sat here now sort of going, I don't understand why I've been sharing this for the last 3 years and it not being kind of looked at and gone, fantastic, there's an asset here and we can take it forward and we can move. It's really bizarre, where I do find that the flow of money isn't quite right, and that is a fundamental blocker for fantastic work being done and opportunities being taken up. And I guess it might be a very reflective of that in big institutions moving very slowly, and people with great ideas or fantastic assets then being missed because they can't move quick enough, respond to those opportunities. So apologies for the very long-winded, but there's something around, have you heard of collaboratives and investment models and these descriptor levels that we've worked on for the arts, and this formalisation of the pathway?
I feel your frustration. I feel the frustration. I think one of the things, and maybe on the detailing and perhaps some of the specific insights there, perhaps you may want to follow up with some personal communications with us, because that can be quite irksome at times. But let me just say that a lot of the focus has been on service delivery, and who's delivering services, and whether that's social prescribing and all the people involved and mobilising them all. It's complex, right? It's complex, and it's not going to be perfect. Any move on that level is not going to be simple at all. What I would encourage you to do is to keep going, and encourage you to keep observing where you get win points, where the win points are, and to illuminate those. And finding money is hard. It's very competitive out there for researchers like myself and universities competing as much as collaborating. The game is on. But what I've tried to do and suggested with, for example, the Arts for Health initiative is to go, and also the Ardman, is where can we go round all the sticking points informationally and make more information available both to the wider public and their agency, and also to creative industries to contribute and be a part of the health of the nation through interesting, large-scale, informational routes, as with the What's Up with Everyone. So I think, we're building. Don't get too frustrated in the itsy-bitsy world of it. And also think about, that idea of who owns delivery here. My view is that we're spending too much time avoiding the agency of the public and the agency of practitioners to organically and communicatively and in a community way build up a head of steam. Hey, our environment looks shit. Sorry to use a technical term. And it looks like a dead meat storage unit. That's not doing my health any good, never mind my patients here. Let's think about warming up the clinic. Some of the moves are about this, information and actually communicating the ideas to each other, managing it through management, all that side. I think that takes some fine-tuning, and it's very context-specific. So it sounds like you've had quite a lot to deal with. Don't lose what you started with. Creativity. Don't lose your focus in all this kind of who's running it, who's doing it, where's it going, who's in charge. Is this medical? Is this nursing? Is this the public? Don't get pulled in. Stay with what you know works.
I think the creative ambition of projects that we run is key, and having a place to showcase them. And that's a very grassroots thing to say, isn't it? Make something, get people to see it. Singing group, get people to hear them. Reading group, make it clear. Because I think that the grassroots experience, the anecdotal evidence, although it's very small, that is what people see and understand. And it's really powerful.
And I think on that scale that you're working at, you've the embodiment of the sort of the empowering people and giving the agency to the people who are doing the work, who are both delivering it and receiving. I think that the idea that Paul is getting to is that we're all responsible for this at an individual level and at organisational level. So I think the idea that we all have this responsibility to bring creative health in, and rather than overthinking it, it's actually just how can we each embed some creative health and bring it into our workplace and make it the norm rather than just something that's nice to have. I think we've got time let's have one more question. Dr. Bleicher, please. Thank you.
Thanks. I'm Tanya Bleicher. I'm a consultant dermatologist in Derby, and it's been amazing to be here amongst you all today. I'm really keen that we improve our productive environments within the clinical setting. And I think it's really hard because of the competing interest, particularly at the moment, the huge amount of pressure on us for service recovery. And without the RCTs, the randomised controlled trials, the data, it's very difficult in a healthcare setting to make people see that a change is for the good. And, I'm just doing a whole load of job plans for colleagues at the moment, and not one of them has got a lunch break. And we're working in this environment where we're back to back, and the pressure is, it doesn't, we forget that pausing and thinking actually activates the creativity and the transformation of our service for the good of our patients. So I'm really keen to see how we can change. And we've got to start small. There's no way you can shift something big like a trust or the NHS. And I think it's going back to my department. What one thing from each of you could I do to make my environment more productive and more conducive to creative health?
I think that's a great question. We're going to finish with this. So this is like the final word from each one. Thank you.
It's great. And let's just get one thing straight. There are RCTs and there is scientific evidence for multiple creative practices for human well-being. So you can perhaps look at some of that and see what might be feasible within your particular clinical context. One thing I would say is that I'd start where I started once on a mystery customer visit to a unit, which is I went to the unit, it was lovely pastel, everything's all the functionality seems great. Okay, and they said, "What did you think?" I said, it's "What a wonderfully designed unit." Oh, and okay. "Your staff room is terrible." I said, "What do they do in there?" He said, "Well, they come there in the morning and they perhaps get ready for their shift, right? And oh yes, and then they come in the break time and they sit in there." I said, "There's an institutional clock in there. There's chairs from some institution somewhere, not homely at all. No cushions, no tea, no coffee. You've got a notice board full of do's and don'ts and threat culture. Is that where they relax?" So I would suggest you have a look at how your environment in dermatology is communicating to your staff and to your patients, and what feasible changes can be made to that environment to improve it. I just went to the leading palliative care unit in Taiwan with Professor Wang, first palliative care unit in Taiwan. And I was amazed that on the little reception desk, there were little music making items that people could relax with when they come in and just tinkle on bells and little, very light drumming. And that's fantastic. And then just around the corner was a tiny, ethically designed fish tank, a portable, tiny fish tank that they take around the unit with them for people at the bedside to get some distraction and so on. But the staff, they're all smiling. The warmth of that environment, the simple things that have been brought in. You don't have to start with a totalized view on this. Make one little change, creative thing. A bit of music, a bit of access to making music on the unit. Maybe some decor changes to make it more homely. That's all.
The first thing I would say is perhaps reach out to someone who's got expertise in creative health to come and visit you and have a look at your environment. I really do take what you're saying about being back to back. I used to work in education. I understand that someone saying to you, carve out some time, is not always a solution. So I think engaging with an artist facilitator, professional in this field will be really, really helpful for you. The second thing I would say is if you can carve out some time, have it as a collaborative period of time where people can work together, because through that experience, whether it's a small reading group or a walking group, people will relax and they will start to talk. And there's something about side-by-side peer support, which I see at Designs in Mind between our members, that is just magical in terms of improving well-being in the workplace.
Make a plan. You're already planning for their time, and they haven't got a break, so make a plan. There's a little thing that comes from a programme from the Royal College of Psychiatrists, which is about managing and promoting positive mental health and wellbeing in the workplace, which is a wellbeing window, and giving people the opportunity to have a wellbeing window somewhere along the line where they can do, and it might be 5 minutes, it might be 10 minutes, but they can do something which may be work-related and may not be work-related, that they can actually go ahead and actually try. My friend's design studio, which is, they do interior design, they have it's Music Friday, so somebody will bring a Spotify playlist in and they'll put it on in the office, and then they will go and see a band who's on that Spotify playlist at some point as a gang together, and that's basically the inception of 6 Feet from the Spotlight, because that's where we found Nothing But Thieves and ended up going to see them in a a band called Nothing But Thieves in a pub in Camden. So just from those little things, we all go to work all the time. We want to enjoy it. We all get great satisfaction from work. People who are in healthcare, my sister and brother-in-law included, do it because they had an overwhelming need to help. They wanted to help people, but they need to enjoy it when they go to work. And I think just finding those little things that can bring back something where people can enjoy themselves. The film and TV industry, people go into it because they have this creative desire. When they get there, sometimes they find it difficult. One of the productions I'm on in Bradford at the minute is working. They've got 5 nights next week because they've written a script that needs dark and it's June, which is not good planning in the first place. But it's really difficult for those people to do. It isn't glamorous. They're in a not a nice place in Bradford, so it's going to be tricky. But they will still go and have a laugh. And enjoy themselves. And I know that's difficult in a healthcare setting but those little moments where you can do things, even if your plan is just to occasionally have a walking meeting, go out and walk instead of sitting in an office, and just go out and have a wander. I know we've had a very rainy summer, but yeah, just have a walk. Do something like that, a walking meeting, anything that can help somebody's well-being, where you're not tied to a desk, or you're not you've not got your phone going and messages every 5 seconds, because we're still in that instant response mode. Yeah, plan.
Thanks, Matt. So I'm trying to sum this whole thing up. So the way to support health and wellbeing for the workforce through creative health is to think really big, but start really small and make it everybody's responsibility. So on that note, I'd like to thank our speakers, Paul, Ruth and Matt. Thanks very much. And thank you to National Centre for Creative Health for hosting these sessions. We will be following this up with our ideas around a theory for change, and I'm sure there will be more work on this in the future. So thank you all for coming, and please do have another cup of tea and a biscuit to see you on your way. So thank you very much.